Our next guests are two of the top experts researching a medical solution to long COVID. Dr. Eric Topo is the director of the Scripps Research Translational Institute, and we should note they are not affiliated with Scripps News. And Dr. Akiko Iwasaki is a professor of immunobiology. I knew I was going to mess it up at Yale. Dr. Iwasaki, I'll begin with you. Do we know why some people seem to recover and others seem to be plagued by COVID for months, if not for years?
Yeah, that's a really good question. We've been trying to answer that question with research. Anyone can get long COVID, by the way. But there are demographics such as female sex as well as age group, 30 to 50 years of age, that tend to have a higher risk for developing long COVID. There are also pre-existing conditions that may predispose someone to getting long COVID. But the precise reason why people get long COVID is still not known.
Dr. Topo, I was listening to the people in our segments that had it, and there didn't seem to be a common denominator, and I know this is frustrating to those of you in the research field. Is there one standard definition of long COVID, and why is it so hard to pin down?
Well, as you reviewed in that segment, there's lots of symptoms, up to a couple hundred that have been described. It's really a mosaic of many different subtypes, and the duration, of course, is important, lasting more than 2 to 3 months. But, it's pretty clear when you have a person temporally related to an infection in the weeks later that they develop these symptoms and they're protracted. And the symptoms usually cluster, they're common, that you can make a clinical diagnosis of long COVID. What we really need, of course, is a biomarker, like a blood test, that we can confirm it and use for tracking and use for clinical trials.
And correct me if I'm wrong, Dr. Iwasaki, the bottom line is it doesn't always happen right after COVID. Sometimes it lapses, and then all of a sudden you wake up one morning, you're both nodding, and it's like, it's there.
That's correct. Some people develop long COVID as a lingering effect of having the acute COVID, while others develop long COVID within the first 2 or 3 months of having the COVID. So it varies between people, but it doesn't have to happen immediately after the acute phase of the COVID.
Dr. Topol, the tough question for you, because you've heard the rumors. I wasn't sick until I got the vaccine, and now it has messed with my DNA because it is an mRNA vaccine. Is it theory, or is there a factual basis for it?
Well, it's basically misinformation. There are rare cases, very rare, ultra rare, where the vaccine is implicated in a long COVID syndrome. But for the most part, the protection of vaccines has not been emphasized enough. And all the studies now support a 40% or even more reduction of long COVID. So this idea that it's induced by the vaccine is really is reaching. There's no real data to support that except in extraordinarily rare cases.
Dr. Iwasaki, describe how it feels to be somebody, as you heard in one of our guests that we had on earlier, and it was in Clayton Sandel's package. She was a fitness buff. She went hiking, she went climbing, she was perfectly healthy. Then all of a sudden she got COVID, and now she can't function. How is it possible that it affects the body that way? And what is it about this virus? What is it about COVID that seems to be stumping the best of us?
Yeah, it's a real medical mystery. Why some people get long COVID and not others. And I've heard many people, as the example you just mentioned, who are very fit and active and at the peak of their career, were just devastated by getting the long COVID and not being able to go back to work and are bedridden. It's really a mystery how that condition develops from this virus. However, I'd like to emphasize that long COVID is not the only infectious disease in which long-term consequences are seen. There are multiple other viruses and bacteria and parasitic infection that leads to similar post-acute infection syndromes like long COVID. So we're trying to understand the commonality between these kinds of syndromes to better come up with a treatment.
Dr. Topol, 30 seconds left. I'll give you the optimistic question. Are we getting better at figuring out what's going on? And are you optimistic? Because you heard the guest talk about anxiety, which is wondering, when will tomorrow be better than yesterday?
I am optimistic, Del, and the reason for that is we've had one randomized rigorous trial recently coming out of Hong Kong with microbiome intervention that led to significant improvement of symptoms. And we're getting, every week better insight about the underpinnings of long COVID, and hopefully getting multiple clinical trials going that will get us to relief of people that are desperately needed, that are suffering long COVID. So in the times ahead, it can't happen soon enough. I do think we'll see some treatments that'll be effective, and we have one example of that so far.
We can only hope. Dr. Topol, Dr. Iwasaki, thanks for being with us.